going to be part of your healthcare team today. I came in here to do a physical assessment on you, if that's okay.
Okay.
All right. First, I'm going to start with lifting your bed up to its waist level with me. How are you doing today?
Alright, honey.
Good. What brought you in today?
I'm having a little bit of knee pain.
Knee pain? All right. And can you tell me where you are?
Yes, Barbara Hospital.
All right. And can I see your thing? And can you tell me your name and date of birth?
Yes, Asia Corcoran, 5/27/1996.
Okay. Vital signs have been attained, and I provided privacy for my patient. All right. And can you tell me what time it is?
Yes, it's about 1:30 p.m.
1:30. Okay. And what day is it?
Wednesday.
Okay. And the date?
I'm not sure. I think like the 5th.
Okay. My patient is awake, alert, and oriented times 4. All right. So you said you had pain today. Where's your pain at?
In my knee.
Okay. Can you point to which knee and where it's located on your knee?
Yes.
Right there. Okay. When did this start?
Yesterday.
Yesterday. All right. And how long does it stay, or does it come and go?
Oh, the pain stays. I fell on it, that's why.
Okay. And can you explain your pain? Like, is it a dull pain, a sharp pain, shooting pain?
It's like a sharp pain.
Okay. And does it radiate anywhere?
No, ma'am.
All right. And have you been taking anything at home to treat this pain?
I only took ibuprofen.
Okay. And on a scale of 0 to 10, 0 being no pain, 10 being the worst you ever felt, where would you say your pain is at?
About a 7.
A 7. And where would you like your pain?
Closer to 0, but a 3 would be okay too.
Okay. All right. Well, we will get that pain assessed after your assessment. Okay. I'll go talk to the healthcare provider. Okay. First, we're going to start. We're going to go head to toe. We're going to start up here at your head, and then we'll just work our way down. Okay. I'm going to put this bed rail down, and I'm going to start up here at your head. I'm just going to look through your scalp real quick, make sure everything's good there. Okay. So I'm parting the hair, making sure there's no lesions, no any type of bugs, no eurythmia, nothing there, nothing behind the ears. Okay, and we're gonna move on to your eyes. So what I want you to do is I want you to stare right over there at that picture, and I'm going to shine the light in your eyes, okay?
Okay.
I'm just looking for your pupils to constrict. All right. And if you can continue staring at that picture over there, I'm going to move this pen in front of your face, and I want you to focus on the pen, okay?
Okay.
Okay. And now I'm going to put up I'm going to put up fingers. Tell me how many you see.
3 fingers.
Okay. And now we're going to do the cardinal fields of gaze. So what you do is, can you see this pen? All right, I'm going to move it. I want you to follow just your eyes, not your head, okay?
Okay.
Okay. Now what I'm going to do is I have assessed cranial nerves number 2, 3, 4, and 6. The pupils are equal, round, reactive to light, and accommodation. Next, I'll move on to some other nerves. So I can tell you're hearing me okay because you haven't had me repeat myself. So I've assessed cranial nerve number 8, the acoustic nerve. Next, I want you to close your eyes. I'm going to put something underneath your nose. You can tell me what you smell, okay?
Alcohol.
Alcohol? All right, good. All right, I'm gonna clean my stethoscope while we have this out. Okay, and then I will assess the rest of your facial nerves. So I'm gonna have you do a few faces for me, okay? Can you raise your eyebrows? Can you smile? Can you clench your teeth? And can you puff out your cheeks? And frown. Okay. Now we're gonna move on to inside of your mouth. So the first thing I'm going to do is I'm going to have you stick your tongue out and move it side to side. All right, there's no lateral deviation in the tongue. Now I'm going to have you open, and I'm going to shine a light, and you're going to say ah, okay?
Ah.
The uvula and soft palate rise symmetric bilaterally. The lips and membranes are pink and moist. And I did not see any lesions, no eurythmia, and all dentation is intact. I'm gonna put my gloves on before I'm gonna stimulate your gag reflex, okay? So next, I just want you to open your mouth. Okay, we're good there. Now, what I want you to do is I'm going to put my hands on your side of your face, and I want you to turn towards my hand, okay? Against my resistance. Okay? We're gonna do this side. Okay? And now I'm gonna put my hands on your shoulders. You're gonna shrug against my resistance. Okay. All right. Next, we will move on. First, before we move on to your lungs, I'm gonna hold out my fingers and I want you to grip them, okay? All right. Grip strength is equal bilaterally. Next, we are going to move on to your lungs. What I want you to do is I want you to sit up away from the bed. And I'm going to listen on the front side first and then move to the back and do your sides. While I'm doing this, I want you to breathe deep in and out of your mouth, okay? Okay, now I want you to put your chin to your chest and give yourself a big bear hug. And I'm going to move on to the back. Okay, and I'm going to do your side over here. And then this side. Okay, you can relax. Your respirations are even and unlabored without the use of accessory muscles. Your chest rises and falls symmetrically. And now I'm going to move on to your heart, okay? So don't be alarmed if I listen for a minute. I'm just listening for certain sounds, okay? So I'm going to start on the right side, second intercostal space, the aortic valve. Move on to the left side, second intercostal space, the pulmonic valve. Third intercostal space on the left side, Erb's point. Fourth intercostal space on the left side, the tricuspid valve. And then the fifth intercostal space, mid-clavicular line, the mitral valve. S1 and S2 sounds were heard distinctly. If I were to assess your apical pulse, it would be right there at the mitral valve. Okay, I'm gonna give you back your pillow so you can relax. All right, now we're gonna move on to your abdomen, okay? Have you had any trouble sleeping lately? Any trouble with your appetite?
No.
I'm gonna lay your bed down some too. And have you had any trouble swallowing?
No.
Okay. What about urinating?
No issues.
And what about with your bowel movements?
No.
When was your last bowel movement?
Today,
And how often do you have them?
1 to 3 times per day.
Okay. So by looking at the abdomen, I don't see any striae. The abdomen looks soft and not scaphoid or distended. The abdomen's skin color looks uniform with the rest of her body. No lesions or eurythmia is seen. The umbilicus looks clean and intact. Now if you could put your chin to your chest and cough for me. No hernias are seen during this assessment. Next, I'm gonna listen, okay? Okay, so we're gonna start at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. What I'm listening for is 5 to 35 gurgles per minute. You have active bowel sounds. And next, I will percuss. If she were to have pain in her abdomen, I would do that quadrant last. So we're gonna start same order, the right lower, the right upper, left upper, left lower. And now palpate. I'm feeling for if the abdomen is soft, feeling if there's any nodules, and then I'm gonna check her temperature, check for temperature and moisture and edema and texture. Okay, next we're gonna move on to your periphery, which is your arms and your legs. I'm gonna put this up since I'm done with up there for now. What I'm gonna do is I'm going to look at them. They look the same length, same size, and same skin color as the rest of the body. I'm gonna check for temperature and texture and moisture. All right, and I'm going to check your calf refill on both, and then your radial pulse on both of your hands. So if I could see this one over here. Radial pulse is equal bilaterally. Strength is +2 and the rhythm is regular. And then if you could, I'm gonna put my hands right here. I want you to push up against my resistance. All right, strength is equal on both sides. Next, I'm gonna move down to your legs. I can see that they're the same color as your skin. No lesions on the arms either. No eurythmia. They look the same length and the same size. I'm gonna feel for temperature, texture, moisture. And now I'm going to do a poke and then a pinch to check skin turgor. It bounces back immediately. And then we're gonna do calf refill on both. And now I'm going to place my hands right here and I want you to push up against my resistance, okay? All right, and we're gonna move on to the feet. I'm gonna feel for your pedal pulse. Rate is 80 beats per minute. Strength is a +2 with a regular rhythm. And now I'm going to test your plantar flexion. So what I'm going to have you do is I'm going to put some hands right here. You're going to push on the gas pedal with both your feet, okay? Go ahead. All right. Now I'm going to check your dorsalis flexion, and I want to put my hands right here, and you're going to push your toes towards your head with both of your feet. Okay. Now, one thing I forgot up here is I'm going to check your skin turgor up here. Okay, it bounces back, no tenting. And I'm going to check for edema over here. And your calf refill came back in 2 to 3 seconds when I did it earlier. And your edema is seen. Your skin turns back to its normal color. All right, next what I'm going to do is I'm going to have you roll this way. And you're going to hold on to here so I can check your backside, okay? So we're going to roll together on 3. We're going to put your arms right here. And on 3, we're going to roll. Ready? 1, 2, 3. Okay, while I'm looking at the back, I'm looking at the head, making sure there's no lesions or bugs or anything like that in her hair or any arrhythmia. And all the hair is intact all over the head. I'm looking at the scapula, looking at the coccyx and the heels. No pressure wounds are seen. All skin is intact. Same color as the rest of her body. No lesions and no eurythmia anywhere. All right, I'm going to have you roll back on 3. 1, 2, 3. Okay. All right, so next I'm going to put your bed down. Do you want me to sit you up a little bit, or is your position? Yes, please. All right, let me know when to stop on sitting you up.
That's good.
Okay. All right, and I'm going to give you your call bell. I'm going to move all of your stuff back over here to where you can reach it. And at this time, I would check your lines in your IV bag, make sure it's the right bag hanging. I would check the site that your IV is in. I would check any dressings you may have. And if you had a Foley, I would check the Foley and the lines for that. Do you have to go use the bathroom? No? Okay, so are you okay? Alright. I'm gonna go talk to the provider and see what we can do for your pain, okay? I'll be back in about 30 minutes.
Okay.